The AGA focus is to try to prevent unnecessary surgeries. And that's a bit of a different focus. When you talk to a patient and you're trying to help a patient decide, there are a lot of factors that go into how the conversation would go, how old the patient is, how the cyst was found, what other family history that they have. There are lots of things that as a physician you would talk to a patient about. But the approach that I have, say, as a pancreas specialist is I often tell patients, I really want to help you make the best decision you can. I'm worried that these are cysts that can turn into cancer. I need to figure out if you are developing cancer, and if you have it, I want to tell you so you can make the best decision with what to do, and if you don't have it, I want to be as confident as I can to tell you that you don't have it. What we call the Sendai criteria, our consensus guideline criteria, they err a little bit on the side of let's find people, if we can find cancer, we really need to find cancer so we can intervene. So we might do a few more surgeries than not in order to make sure that everybody who has cancer is taken out. Because people want to know, if I have cancer, I want it out. People want to get cured of their cancer. The AGA criteria take a little bit of a different approach where they say, we really don't want to do surgery for people who don't have that cancer because the surgery has with it downsides. There's surgical morbidity and mortality, and those are somewhat philosophical differences, but they also necessarily play into the performance of those criteria and how confident we can be in telling a patient whether or not they have a cancer. In all the data that we're presenting today, what we're showing is that the molecular testing can help both of those scenarios for patients. Both of those criteria do better than they are now. Right. So these data come from a pancreas cyst registry data that have been collected over the recent years, and the data that we are analyzing are people who we have enough information on, who have had the molecular testing as part of their standard of care, and really importantly have had 2 years of follow-up. So all the patients either had an outcome, meaning they had cancer and had surgery, then we know they had cancer. But if they were in the surveillance program, we followed them for at least 2 years. And that's really important because it adds to the robustness of this data. So these data, what they really compel us to do, or what's really compelling about the data, is that they show that if we can use the molecular testing in addition to our clinical physician-patient interaction approach to an individual, that we can use these data very robustly to say, I can help you make the right decision. Going forward, we need to be able to ultimately validate all of these approaches. For example, the AGA criteria are recommended new criteria that are not validated at all. There's some validation that we have on the molecular testing. It's been around longer than the recently published criteria. Ultimately, what we need to do is to have thousands and thousands of patients who have all of the data put together and then say, at the end of the day, have we really benefited patients or not? And part of the data that we're presenting today in retrospective fashion does just that. It actually shows that by using the molecular data, we are impacting physician decision making on these patients and helping them make the right decision for patients. And our data are very strong in that regard. What we want to do is have this validated in a prospective set. The way we test for pancreas cysts really gets back to helping physicians make the right decisions for patients. And it is very clear from the many thousands, over 14,000 patients have had this test performed as part of their clinical management. In the many thousands of patients, it's becoming increasingly clear that this testing can really help doctors and help patients end up at the right place. And our hope is that as our data continue to emerge, that it'll further strengthen the data supporting that approach.